I look at it more as an elongated and an exacerbation of the original first wave. We never really cleared and got down to a very low baseline. No matter how you look at it, it's not good news.
Dr. Fauci, of course, talking about the surge that we've seen in COVID cases, and the attendant hospitalizations are happening all across our country. More than 37 states, they're seeing their case numbers rise over the past week. U.S. still averaging more than 70,000 new positive COVID cases every day. The country also seeing more than 800 deaths a day. The fatalities now topping over 226,000 nationwide. We're also seeing a surge of people who are now being forced to go to the hospital. 16 states seeing record numbers of patients, and you can add the state of Utah and the city of El Paso, Texas, joining Wisconsin and other places that are being forced to open up field hospitals to deal with the surge as they're out of bed space. The mayor of Salt Lake City acutely concerned.
University of Utah, one of our biggest hospitals, was at 99% capacity with their ICU. Their nurses and doctors are working extended hours around the clock. They are exhausted. We are in a dire situation. We're the most vulnerable that we've ever been.
Things getting so dire in Utah that hospitals, they're warning they could soon have to ration care and obviously access to ICU beds.
I did not think we were ever going to get to a point where we were going to deny people care in the ICU based on age or how sick they are. If that's starting to happen already, and we have many, many weeks of this surge to go, I am starting to get concerned that we may get into trouble.
Now, over the past 7 or 8 months, we've been talking a lot about, obviously, the Americans we've lost here to COVID and the overwhelmed hospitals, and we've done so for good reason. But I should mention that's only part of the story. Sometimes people look at those two numbers and they think, well, those numbers don't fit into categories. They were better in less than 2 weeks. Maybe they didn't even have symptoms at all, if that was only the case. We have been speaking with people who call themselves long haulers because they have been battling health problems for months after contracting the virus. Unfortunately, the numbers, they're in the hundreds of thousands. And now we're learning that even children have lingering problems that can last for a very long time. I want to bring in my next guest who can speak to this. She a long hauler who first got sick in March, and she hasn't felt the same since. She had everything from loss of balance to fevers, horrible nightmares, shortness of breath, and much more. She's still suffering from debilitating fatigue and breathing problems. I want to welcome to the program Marjorie Roberts, and thank you for this story. And I got to tell you, Marjorie, I've spoken to a lot of people like yourself, and it is eerie how similar their experience has been, in that they think, you know, after a couple of weeks, this is bad, I'm going to get over it. And one symptom might go away, but then another one will come. And it just knocks you off your feet, and weeks turn into months, and now you're 7 months into it. You've described it as agony. Is that a right way to describe sometimes the pain you're in?
Yes, it is. Mentally, emotionally, and physically, I've been through the ringer. It's just a lot. It's just really a lot. And it's taking a toll on my family and my friends. And I don't know. I don't see the end. I don't know. It's every day of not knowing.
As is usual with many of the cases I've talked to, almost as bad as the pain is the lack of cooperation or even belief that you're getting from medical professionals. I read here, tell me if this is right, one doctor thought basically this is all about anxiety. They told you, hey, stop watching the news, watch some happy movies. Is that really what they told you?
Yeah, that's what she told me. My first primary physician, she had been my doctor for 5 years. So I really thought she knew me and knew my body. So after going to her, after being turned away from the emergency room and going to her, being told to go and see my primary physician, that's what I did. And when she, she totally gaslit me. It was so hurtful because I thought I had such a good rapport with her. We had always talked about everything, our families and friends and life. But she told me to stop watching so much television because I was mimicking what I was seeing on television, and to watch Lifetime, watch some feel-good movies. And she wanted to put me on medication for anxiety and stress. And I told her it wasn't stress. I knew it wasn't stress because I was a single parent, and I knew it wasn't stress because I had went to school for 9 straight years, but she totally blew me off and did not believe me.
You have a daughter who works in the medical field, and she worked with you. You got a different doctor, and the doctor discovered that, in fact, you did have COVID, unlike some of the initial tests that you got. They've run a battery of tests. They're concerned, as I understand it, about your lungs and a series of other health care issues. How is your health right now?
Well, currently I'm still under the doctor's care. I'm still working with my lung specialist because it was discovered that I had these nodules that have formed in my lungs over a period of time, and I had a lot of scar tissue, and they went in and did a biopsy on those nodules, and they aren't cancerous, but they're still there. So we're just trying to figure out where do we go from here, because I got sick on March 26th. And it wasn't until June 8th, once I had got a new doctor and she had ran all those tests and discovered what was going on. Because I had 3 separate trips to the emergency room and I was so sick. I was so very sick, but it took all that long time to find somebody who would believe me and work with me.
As I understand, things got so bad, you talked with your family about a living will, discussed life insurance policies. And I mention that because I want to play a clip. This is after the president, who I should mention, by the way, had around-the-clock care with 12 specialists, by his own words here, was given every therapeutic known to mankind. After all that, he said this.
I learned so much about coronavirus, and one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it.
When you hear your president say, basically, don't sweat it, Marjorie, don't let it dominate your life, what's your reaction?
My first reaction was anger. I was so mad with him. But then I decided a long time ago, because so many people were saying that it was a hoax and so many people were brushing us off. And I had a really good friend to die from COVID. And after my friend died, I said I had to get a new attitude. All I can do is pray for him, because that's a scary thought, to know that he just brushed it off and that he just really doesn't care. And all these lives have been changed forever. And it just bounces off of him. So really and truly, I have no words for him. I have none, except for I hope at some point in time he finds peace of mind, because this is real. COVID-19 is not a hoax. And the fact that he got it and his family got it, and it's still spreading around the White House, and they're all pretending that they're in the land of Oz.
Well, Marjorie, I really wish you a recovery here. Hang in there, and thank you so much for having the courage to share your story with so many. Thank you.
Thank you. Thank you so much, and you be safe.
You as well. Now, over the past few weeks, we have been speaking with a lot of folks like Marjorie, long haulers, and we'd like to hear from you if you survived COVID and want to share your story with us. If you're interested, please email us at rfl@rnntv.com. You can also send us a tweet. Our handle is at LarryEP13. All right, when we come back, we're going to pivot back to politics. We're going to take a look at a population that has been, if not taken for granted, ignored in many parts of this campaign, the Hispanic vote. It could prove pivotal in several of the swing states that are needed to win. We're going to show you why the latest numbers are good news for one of the candidates. We'll tell you which one after the break.